Good afternoon, everybody. Delighted to have the opportunity to speak at this conference. Unfortunately, I had planned to be there, but I won't be able to make it. I'm isolating from COVID, but hopefully this speech will work just as well. As you're aware, the last 2 years have placed unprecedented strain on our health system. The COVID-19 pandemic, combined with the cyber attack in May of last year, have impacted our systems and capacity, and particularly our staff. That we have been able to deal effectively with these crises is due in no small part to the contribution of private hospitals and their staff. From the very start, the private hospitals were quick to stand up and offer support, and this cooperation continues to this day. I would like to again thank the Bon Secours network for their willingness and flexibility to work with the state to ensure patients got the care they needed despite significant challenges. The additional capacity provided by private hospitals through our safety net arrangements have been essential in helping us navigate the crisis by maintaining urgent and time-critical care. And of course, the safety net arrangements are in addition to the long-standing arrangements between the NTPF and the private system, under which each year tens of thousands of patients receive inpatient and day case, diagnostic and outpatient services in private hospitals. Whilst effective, the safety net agreements were designed as emergency responses to the critical situation faced by our health system. They were not designed as long-term agreements to deal with long-term issues. With the current safety net agreement due to expire in June, and as we hopefully emerge from the pandemic after 2 years, we now need to look at how our public and private systems can continue to work together into the future. There clearly remains a requirement for additional acute hospital capacity, even before the threat of possible future COVID surges. While long waiting times in Ireland are unfortunately not a new phenomenon, the effect of the demand that built during the pandemic, plus current significant pressures, means that as of February this year, over 730,000 patients are waiting for scheduled care, with 625,000 waiting for an outpatient consultation, 78,000 for an appointment for an inpatient or day case procedure, and 28,000 for a GI scope. In November last, the Minister for Health published a short-term waiting list action plan. This plan resulted in some improvements in both waiting times for patients and the waiting list numbers, which fell by 5% between September and December. This was achieved with the collaboration of the HSE, the NTPF, and private hospitals. However, the fact that more than 730,000 patients are still waiting for care is unacceptable, and a whole system response is required. Tackling the current waiting list is a priority for the Minister and the government. We will continue to need the support of private hospitals in addressing the backlog and the gap in services while we implement real long-term reform actions. In February this year, we continued to focus on waiting lists with the publication of the 2022 Waiting List Action Plan. 350 million has been allocated to HSE and NTPF with a dual focus. Firstly, to deliver immediate additional activity to reduce waiting list numbers and moving towards achievement of maximum waiting time targets this year. And secondly, further development and implementation of the foundations for longer term reforms over the coming years. Looking at these both in turn. Under the plan, our immediate priority is to deliver additional activity and thereby reduce the numbers waiting, with a particular focus on long waiters. Of the additional 350 million provided, 263 million has been allocated to the HSE and NTPF this year to source additional outpatient and inpatient activity. A substantial piece of work to identify the specialities and indeed procedures which will be targeted is nearing completion. And in the meantime, the HSE and NTPF are collaborating to procure as much additional activity as possible using the existing arrangements. In parallel, we are kicking off key reform actions in line with the principles of Sláinte Care. These reforms are based on increasing our capacity, reforming where and how we deliver services, and utilising data and information systems more effectively. These reforms include the rollout of 37 modernised care pathways across 16 specialities, and improving the quality, use and analysis of our data to enhance understanding of existing and future capacity, thereby ensuring better planning and better service delivery. The 2022 plan is the first year of a multi-annual reform programme, which is the only way to bring about real, meaningful and lasting changes to our waiting list challenge. However, implementing these reforms will take a number of years, during which we will continue to require the support of the private hospitals, not solely to help reduce the existing waiting lists, but also to compensate for the capacity deficits which the reforms are intended to eliminate. And while our existing arrangements, particularly the NTPF model, have served us well to date, it is appropriate that we consider in detail how the public and private systems can best work together into the future, considering the complex and multi-annual nature of the waiting list challenge we have, building on the excellent relationships which have grown between the state and the private hospital sector over the course of the pandemic. In addition to support with waiting list, the state will need support in some cases against seasonal challenges, and of course, some level of commitment of support against a further resurgence of COVID. Currently, the state is using a number of arrangements to source support and service from the private hospitals. Obviously, and crucially, we secure substantial waiting list and diagnostic activity via the NTPF. We also secure support through the safety net agreement, a procurement framework, and a small number of local arrangements. These have worked well for all parties to date and will be fundamental in delivering the 2022 action plan. That said, this 2022 action plan is the first step in a longer multi-annual waiting list reform programme, as it will clearly take a number of years to address the issues which have beleaguered our health system for many years. And a multi-annual reform plan needs multi-annual arrangements with the private system. The impending expiration of Safety Net 4 provides the opportunity to reflect on how the state might best engage with the private hospital system. And in considering this question, we believe that the solution lies in the development of a strategic partnership. And I'd like to talk a little bit about the three key features I believe such an arrangement would have. First and foremost, it would be multi-annual, by which I mean that commitments, both to procure and to provide, would extend beyond the current 12-month horizon we use. This would allow both parties to such an agreement to properly plan, providing certainty on both sides, ensuring that we all know what needs to be delivered, when and by whom. This has obvious advantages. We minimize the risk of limited capacity at a time of great need. We work towards set targets to better understand and address blockages, and we ensure a fair and even divide of activity based on capacity. Secondly, any strategic framework will be strategic, meaning that it takes a broader view of the waiting list challenges and encourages all parties to consider solutions outside their existing operating models. A particular area we're interested in development is the medical outpatient space. Our arrangements with private hospitals to date have largely focused on inpatient and GI scope activity. However, outpatient appointments account for the largest proportion of waiting list figures by a significant amount. Of the over 700,000 people currently on waiting lists, over 600,000 of them, about 85%, are on the outpatient waiting list. In 2021, the NTPF successfully established arrangements in relation to outpatients in surgical specialities with subsequent inpatient treatment if required. And we would seek to build on these arrangements. While we acknowledge the challenges in introducing medical outpatient appointment arrangements, this is clearly an area where a strategic partnership model would support the development of such an arrangement. And we look forward to engaging in further discussions with the private hospitals in this regard. And finally, the third element is partnership, which means we can adopt a shared risk and benefits approach, enabling a focus on patient outcomes and delivery for the whole system. It is unlikely that a single arrangement will be the solution, and instead I envisage a series of partnerships with individual private hospitals reflecting innovative solutions to the different elements of the overall waiting list challenge, and building on existing strengths. As a first step towards the development of this strategic partnership, representatives from the department, the HSE and NTPF have formed a working group under the governance of the waiting list task force to determine the best approach to development such a strategic relationship. This group is considering the existing arrangements to ensure that any new agreement retains those elements which work well. We are modeling our expected future requirements, and we are engaging with individual private hospitals to gather their views on what a strategic partnership could be. Feedback so far has been very encouraging, with all parties confirming their continued willingness to help with the waiting list challenges. As part of this, we met with Secours on the 3rd of March and are pleased that so far the discussions have been engaging and productive. We note in particular the willingness on the part of the Secours network to continue its ongoing partnership with the NTPF and to look at the provision of facilities, bed capacity, diagnostic staff and management to augment the capacity of public hospitals. The ongoing commitment to supporting the challenges facing the health system is hugely appreciated, and we are eager to continue this relationship. On behalf of the department, I would thank the Secours network for its support during the pandemic and for the ongoing proactive collaboration. We look forward to forming a strategic partnership that will ultimately deliver for all our stakeholders. I'll finish there, but just to thank Bill for the opportunity to speak and to thank you all for listening.